Hi, I'm Addie Vilhauer, Paige's friend.
Hi, I'm Susan Vilhauer.
Hi, I'm Barb Buckles.
Up to 30 million people of all ages and genders suffer from an eating disorder in the U.S., according to the textbook in psychiatric epidemiology. In this speech, I'm going to tell you a little bit about different kinds of eating disorders, how to approach somebody if you suspect they have an eating disorder, or if you yourself have an eating disorder and need to find help, and different risk factors and causes of eating disorders. With our country's outlook on being overweight and what the image of beauty is, many people struggle with an eating disorder. That being said, some of the main eating disorders that we think of are anorexia, bulimia, and binge eating disorder. But there are some other ones that don't involve satiety, such as pica, rumination, avoidant and restrictive food intake. We know what anorexia is. It's strict dieting, constantly wanting to watch your figure and lose weight. Bulimia, you're going to eat your normal meals, but you use means to get rid of that food, such as vomiting, using laxatives. And then binge eating disorder, where you would eat your normal meal plus that. And a lot of times people do it in private, or just they do it when they don't think people are watching, or even if they do, and when they do, a lot of times it can be more similar to bulimia, where they're gonna go and vomit it up so they don't gain that extra weight. But some people use it to gain extra weight because society tells them that they're too skinny now and they need to gain weight. Where we have pica, which is an eating disorder where you eat non-food items, such as soap, chalk, dirt, and something like that can be more of a medical issue where there's something wrong with you mentally, or something wrong with something within you that causes you to crave that. Rumination is repeatedly and persistently regurgitating your food. It has nothing to do with being nauseous or wanting to watch your weight. It's just something that happens after you're done eating. And then there's something like the avoidant and restrictive food intake, and that would be when you have no physical interest in eating food. The look of it, the smell of it, it doesn't appeal to you. So for all of those, there's no fear of gaining the weight or wanting to look thin. Those ones are actually medical issues, where they all are. But the bulimia and anorexia and binge eating have more to do with your mental health and what society portrays as beautiful to you. If you think someone has an eating disorder, there's a right and a wrong way to go about approaching them. You should probably not just go up to them and be like, hey, I think you have an eating disorder. You need help. They might take offense to that. And maybe they don't, so you should ask someone close to them their opinion on it, what they think, if they've noticed anything, or ask them to start watching. And once you've approached the situation, you should seek medical attention and get them help so they don't harm their body. Things like bulimia and stuff, they ruin your esophagus and your teeth and your stomach from constantly throwing up. It ruins your intestines if you're constantly taking laxatives. Anorexia, you're malnourished. It's hard on your body. And then if you have an eating disorder and you want to find help, you know you have one, you want to find help, you should, first thing most people do is talk to somebody they're close to and ask them to help them. And then normally you still go to the doctor and they can help you find a program or different things to help you get away from that. When you're seeing a doctor, you can ask them if they think you are at risk of an eating disorder, because a lot of times they're saying that if you have a history of people in your family with different eating disorders, you're more likely to develop one, or if you're around people that have them, you're more likely to develop them. And other things such as being a female your age. If you're always concerned about exercise and dieting, that can go wrong. You can take it too far. Stress, sports, work, and artistic activities, those all factor in too. Society, you are affected through the media, and as I said, your family and friends. Your family and friends can impact you by just saying a simple comment that you might take the wrong way. And it has to do a lot with mental things that cause you to want to look thinner, or then the the physiological aspect is something could physically be wrong with you that cause you to want to be that way. So you have to take all those into aspect when you think of eating disorders. There's different types, how to approach somebody, and if you're at risk for one. That being said, what's my spot? With our country's outlook on being overweight and what the image of beauty is, many people struggle with eating disorders.